So we can talk a little bit about prostate cancer. There's been a lot of media in the press recently about the value of prostate cancer screening and whether we're doing more harm than good. So obviously prostate cancer is still a very important problem in the United States, about 200,000 cases this year and still about 27,000 deaths. Currently, a male born in the United States has a 1 in 6 lifetime probability of diagnosis. So this is something that affects many, many people, and if it hasn't affected you, then you'll know somebody that it has infected. This is a recent from the cancer statistics looking at the incidence of different cancers in both male and females in the United States, as well as death from cancer. And you see that prostate cancer is #1 diagnosed cancer in males and has now become the #2 cause of cancer-related death in males in 2009, according to estimates. This is again from the same cancer statistics looking at the death rates and what's happened over time. And up until the mid-90s, the rate of mortality from prostate cancer slowly was rising and then began to decline. And initially there was a lot of excitement regarding this decline and whether it had to do with the advent of PSA screening. PSA test was approved in 1988 and really started becoming more widespread in its use in the early 90s and mid-90s. But there has been a lot of conflicting data about whether the PSA screening is actually making the difference. So Dr. Whitmore was a former chief of urology at Memorial Sloan Kettering and really a giant in the field of urologic oncology. And at the time of the PSA testing and when a lot of the diagnosis of prostate cancer started becoming more rampant, he really framed the debate in that, and he said that is cure for prostate cancer possible when patients whom it is needed, and is cure needed for those in whom it is possible? And we're still answering this question today, 16, 17 years later. So what do patients want? If you, this is a 2004 study from JAMA where they took a couple thousand patients and interviewed them, and if you asked them if you could be screened for a cancer in which there was no cure, would you still want to know? And more than 60% said yes. And if you ask patients, is screening a good idea in general, much more than 80% said that it's yes. So this is certainly something that the public is interested in terms of screening, even if we don't necessarily have a cure or a good treatment for the disease itself. This was published late last year, and this is from the U.S. Preventative Task Force and their current recommendations in that for patients younger than 75 years old, this current evidence is insufficient to assess the balance of benefits and harms of screening. And so at the current time, the United States Preventive Services Task Force does not recommend routine screening. And this is a graph of a recent paper just came out this week or last week, which is really the crux of the question, in that the white areas on these graphs are patients that are still alive. This is over a 10-year time. And this is different stages of disease. All of these are moderately grade, which is the bulk of prostate cancer, and these are different age groups. And the real issue is that over 10 years of time, for most of these patients, the dark shaded areas of the patients are going to die from prostate cancer. And so with PSA screening, we have an incredible lead time bias, and the real difficulty is trying to predict what is going to happen. You know, we used to always say you have to 10 years ahead of time, but in more recent time, we're talking about more like 15 or 20 years ahead of time in terms of what's going to happen with the cancer and what's going to happen with the tumor. This was an early study out of Austria where, probably couldn't be done here, but in Austria, where they took an isolated county that was in a mountainous region, and they offered PSA screening to everybody. They publicized it, they gave it out free, and in the rest of Austria, they did not. They basically denied PSA screening to the rest of Austrian men. And they looked to see what happened with cancer rates, or prostate cancer rates. And basically, what you see here in this graph is that in Tyrol, the rate of prostate cancer mortality declined much more rapidly than the rate of decline in mortality in the rest of Austria. So this was some early evidence that maybe PSA screening is making a difference.